My name is Dr. Marcia Dewey, and I'm an audiologist here at Froedtert in the Medical College of Wisconsin's Health Network. I came to Froedtert in the summer of 2007, but I've been practicing in audiology since 1999. I have a bachelor's degree, a master's degree, and a doctorate degree in audiology, and I completed a year fellowship program in audiology at a non-for-profit organization in Kalamazoo, Michigan. I see patients of all ages. My specialty area is tinnitus. So a year after coming here, I did my first training, more intensive training in the area of tinnitus. And that training became an interest, which became a passion, which became our tinnitus and hyperacusis program. So now at this point in my career, I specialize only in tinnitus and sound sensitivity disorders. And that can range from young children up to older adults. So I will see everyone. So when someone comes to us with tinnitus or sound sensitivity, there are several different things that we can offer. First, we do a very comprehensive workup to see what's going on with their ear. A very small percentage of cases, there may be a medical workup that needs to be done after that assessment. In most cases, we are helping patients to manage their symptoms. So there isn't a universal cure for tinnitus, but there's a difference between no cure and no help. And we definitely meet our patients where they are and help them to learn strategies and tools to reduce the impact of the disorders on their lives. We help patients to use sound therapy to reduce the intrusiveness, to help distract from the tinnitus. Oftentimes patients are very stressed. So stress impacts tinnitus significantly. So we really help sit with someone and get to the heart of what else is going on in their lives that might be impacting their symptoms and how we might find other tools such as relaxation, stress management, and other areas of their lives that could be exacerbating their symptoms. So my philosophy when working with patients is to meet the patients where they're at. So what I mean by that is some people come to us and they're at the beginning stages and they just want to know what's going on. We'll complete a comprehensive evaluation. What's going on with their ears? Why are they hearing these noises? Or why are they having sensitivity to sound? Other people are further along in the process. So they may have already gotten their medical clearance and be seen in the ear, nose, and throat department, and they're ready to start the management phase of getting their life back and getting some relief with these conditions. My other philosophy in working with patients is to see the patient as a whole person. So oftentimes we look at just the physical, which is an important part of what's going on, but I also like to pull back and look at the whole person. So I look at a person not just from their body, but also their mind and heart. And that helps me to determine what their most important goals are and how to get them on the best path for healing. What I love most about what I do is being able to impact patients' lives. So oftentimes people come to me and they can be extremely distressed and even debilitated by their condition. Sound sensitivity disorders and tinnitus can impact people's lives greatly. And oftentimes they've gone to many places and been told there's no help and there's nothing that can be done. And nothing can be farther from the truth. We help people every day. And the joy I get with watching a patient leave my office with hope again, it just makes everything worthwhile. So when I'm not in the office, I spend my time with my family. With my husband and my son. We like to camp and spend time out in nature. One of my more character strengths is that I love to learn. So I'm always reading a book, listening to a podcast, doing a training, listening to YouTube videos. So I'm always learning more as every day goes by.